Hey everybody, hope you all are doing well and welcome back to Michael's Matters. And as we are close to the end of this year, we get lots of updates to things that are changing next year in 2024, which could really affect older Americans, retirees, and folks on Social Security's benefits. Things like the COLA, or the cost of living adjustment, things like the earned income limit for folks who are on Social Security and are still working but retired a little bit early. Check out that video we did earlier. I'll put a link up here for that. But also increases in things like healthcare, which really do bite into older Americans' monthly budgets. In this case, specifically for Medicare. So today we are going to be talking about what is the new increased Medicare premiums for 2024 and how that would affect the average retiree who is receiving retirement benefits and how it compares to previous years. Now, of course, this is Michael's Matters, and before we get to it, if you like these videos, if you find them interesting, if you find them helpful, or hey, if you at least find them useful, please don't forget to like and subscribe, because it really does help the channel to grow, and we are so thankful for that. But also because you get updates when our newest and most informative videos become available. All right, now let's get down to the video. So let's start off with the numbers for Medicare, because despite what a lot of folks think, Medicare, more specifically original Medicare, even more specifically Medicare Part A and Part B, which makes up original Medicare, well, it's not 100% free. Medicare Part A usually doesn't have a cost for a majority of older Americans who are on it because they paid in a minimum of 10 years or 40 quarters into the system via a payroll tax while they were working, or if they are still working, which is one of the main culprits for the reasons why when you got your check, or when you get your paycheck every month or every 2 weeks or every week or however you get paid, there is a difference between how much you get paid versus how much actually ends up in your pocket. Either way, yes, Medicare Part A is mostly free with the exception of those folks who don't work enough time, and that is a rare minority. But Medicare Part A is really only half of original Medicare, and it does cover things like hospital coverage. But the second half of original Medicare, which is Medicare Part B, it does have a monthly premium, and it covers the normal day-to-day healthcare costs like doctor's visits, lab works, x-rays, and notably medications that are administered in the doctor's office and require doctor's supervision. So not the drugs that you end up getting a prescription for and go get them at the pharmacy. The cost for Medicare Part B typically goes up each year and is based off an overall estimated cost for healthcare coverage for all Medicare beneficiaries in the future year. In 2023, the Medicare Part B premium was $164.90, which everyone paid, regardless of how many years or quarters they actually worked or paid into the tax. They still got to pay the Medicare Part B premium, and this year it was a rare step down from the previous year. It actually went down a little bit. But now, for next year, the monthly premium for Medicare Part B is going to go back up to $174.70 for 2024. This ends up being an increase of $9.80 for most folks on Medicare. If you make a lot more money, if you have a higher income, then that even goes up even more than that. And percentage-wise, this is an increase of 5.94%, which is still going to be a bit higher than what the last 10-year average for Medicare Part B premium increases were at around 5.61%. So obviously, those are the big numbers, right? And they really are going to mean a sizable difference in the pocketbook of older Americans, retirees, and folks on Social Security. And the reason being is that we can see that although the dollar amount is not that big, $9.80 a month, that's not a ton, but it is something for sure. And when you add it all together for the year, that is an increase of $117.60 that seniors are not going to have. But the percentage is really what is the most worrying thing to look at. Now, according to Senior Citizens League, a nonpartisan advocacy group for seniors' rights, their survey found that 80% of current retirees want better safeguards on retirement benefits against rises like this on their Medicare. The need for these protections become very apparent when we compare the Medicare Part B premium increase to something like the cost of living adjustment, or COLA, that folks on Social Security get every year. And this year, specifically, that COLA was at 3.2%, and it starts in January. So when we know that, it is plain to see that the Medicare Part B premium is increasing more than the COLA because Medicare Part B went up 5.94%. What this ultimately means is that the percentage of the average retired American's budget is going to be eaten up more next year by Medicare costs than it was this year. And that's not including the 20% cost that is not covered by Medicare for medical services, for the deductibles, the medications, hospital fees, and everything else like that. This is just the pure monthly premium that gets paid whether somebody uses the coverage or not. That fixed cost is going to end up taking more of the seniors' yearly budget than before, and although the increases, again, are not a lot, even percentage-wise, they never, ever go in reverse. To get an example of how this affects the budget, let's take a look at the average Social Security benefit as of 2023. Now, I know nobody is average. These averages are, averaged out, but no one actually is right at this number. Most people are below it, and a few people are way above it. But we're going to use this number as just kind of a placeholder to see. So the most recent average Social Security benefit in September 2023 was at $1,841.27 for the average American person on Social Security retirement. The current Medicare Part B premium for 2023 is at $164.90, which means that it eats up ultimately 8.96% of a retiree's monthly budget this year. When we add that 3.2% COLA increase to this number, to the average monthly benefit, it means that it ultimately goes up by $58.92 in 2024, which puts it at $1,909.40. But with the new higher Medicare Part B premium at $174.70 in 2024, going up by 5.94%, it means that the Medicare Part B will now eat up 9.15% of the average retiree's budget. Of course, again, it is easy to say. It doesn't seem like a lot of dollars. It's just a few dollars, really. But year over year, as the cost of healthcare goes up faster than general inflation and faster than COLA for that matter, it means that seniors and retirees will have less and less real purchasing power and less actual dollars in their pocket to be independent and stable on their own. It's also important to note is that the number that we use, that average Social Security retirement benefit, is the highest of all versions of Social Security benefits, which means that they are most able to absorb some of those additional costs from Medicare as they are the highest average monthly benefits. But if we look at other ones, things like Social Security Disability SSDI benefits, Medicare premiums for 2024 over average will take up 11.39% of those benefits. And even more so for some of the lower paid Social Security benefits like Social Security spousal benefits, which would mean that Medicare Part B in 2024 would eat up 19.6% of their benefits. So what are some of the reasons why Medicare costs have gone up so dramatically? Well, there's a couple reasons for this. First is that there has been a slate of new Alzheimer's drugs or overall drugs that are available, as well as diabetes drugs that have been approved by Medicare to treat those diseases that have wreaked havoc on seniors in America, but they are not cheap. And it is good to have these drugs approved and accessible by folks, but it's not free. In fact, the cost for some of these drugs can amount to as high as $50,000 or more to get them. Well, that cost, it does end up getting spread around to everybody. The individual people on Social Security and on Medicare, they're not going to pay it, but that overall cost for everyone getting it does get spread out through the premium to everyone else who is on Medicare. And it is good to have these drugs approved and accessible by people, but it's not free. And in fact, the cost for these drugs, some of which can amount to as high as $50,000 or more to get them, well, that cost ends up ultimately getting spread around to everyone, spread to everyone who is on Medicare via those Medicare Part B premiums. Additionally, there has been really a huge increase in healthcare labor, medications, and administration, plus, of course, profits for insurance companies and hospital networks. All those things factor into the overall cost and, again, get passed on to the American Medicare beneficiary. Lastly, and most noticeably about this is on the congressional side. So on the political side, no one has put together a plan to put additional funding into Medicare or Social Security for that matter that would help to alleviate these unexpected costs and inflation that is, consistently robbing retirees of their purchasing power. So I don't know, to not leave on a sour note, there are some positive things that are happening on the political side that may help to provide some release from this problem, of course, if it ever gets actually voted in. For example, things like a limit to how much prescription costs Medicare beneficiaries can have, allowing Medicare to use the vast numbers of its members to negotiate prescription prices and things like the Social Security 2100 Act, although it has been reintroduced 5 or 6 times at this point. If it ever does get to pass, it'll provide a lot of additional money into the hands of retirees and updating the way that the COLA is calculated so that it better reflects the realistic costs that seniors have and also to raise the floor of benefits for those folks who are on the lowest side of Social Security benefits, like SSDI and spousal benefits as well. So if something like that passes, it would be great. It would really be a big help, but we have Congress the way it is, and that's the way it is. So all these things are out there floating around, but they still have to pass. Don't forget to write your Congress people, folks. All right, so that's it for today's Michael's Matters, and I really hope that you found it interesting. I hope that you found it helpful or at least useful, and if you did, please don't forget to like and subscribe because it really does help the channel to grow, and we are so thankful for that. But also because you can get updates when our newest and most informative videos become available. So, for Michael's Matters, I'm Michael, hoping that you take care of yourselves, take care of others, and have a happy, healthy day.